I'm Dr. Ashoojit Kaur Anand. I'm the Clinical Director at PCMH Restore Health, Sheshadripuram, Bangalore. I'm also the Founder Director of Aviksha, a home-based primary care. My expertise is in HIV, palliative care and geriatric care. When somebody has symptoms of cough, cold and fever, and doesn't mean that everybody should run for a test, but it is advised to get tested, because the more number of people get tested, the containment of the spread is better. So keeping in mind the public health view, more and more testing should be done as soon as somebody develops symptoms. But people should not panic that any kind of fever, cough, cold, you need to run to get tested for COVID-19, because it could be just an influenza infection as well. And the different types of tests available, we have the Rapid Antigen Testing, which has a good specificity. That means if somebody is positive, it is definitely positive. But it has a very low sensitivity. That means if somebody turns negative, we are not 100% sure that this person is negative. And this would require a confirmative test with what is called the PCR testing. And so the PCR testing is another type of testing. And then we also have the antibodies testing. The antibodies are what our body produces in reaction to an infection. So in COVID-19, when somebody gets COVID-19 or any kind of respiratory infection, the antibodies are what are produced to fight the infection. And these antibodies are detected, are known to be disappearing after a period of 3 months to 4 months, but that does not mean that a person does not have the resistance or the power to fight an infection. So the best way to test, of course, is the rapid antigen testing, but keeping in mind that if somebody has symptoms and the test comes negative, it has to be confirmed by a PCR testing.